Hi, everyone. Dr. Rob here with some thoughts for you on GLP-1. I'm sure everyone is aware, and many of you are interested in GLP-1 receptor agonist pathways, how they're being leveraged by medication, and how we can elegantly and safely leverage these same pathways with lifestyle and supplements. You're going to see a new full script package that I have labeled GLP-1, and it has 3 supplements in it. And you can look forward to some work in early 2025 where I'm excited to be planning on talking to the full script associated teams that helped build a whole GLP-1 support protocol / template. For today's purposes, why use a GLP-1 receptor agonist supplement? And we'll just for shorthand use GLP-1 today. The two sort of balancing act issues are that if we don't do something about the epidemic of obesity, inflammation, diabetes, prediabetes, elevated blood sugar, insulin resistance, et cetera, we're not going to win these key battles that we need to win for people and for society. And also, if we solely address this with GLP-1 receptor agonist medications, we're simply not going to be able to afford it, but also we're going to miss an opportunity to do what I would characterize as elegant GLP-1 support with many of the benefits and not the downside. So what's the downside to the GLP-1 medications? There are rare instances of bowel obstruction and inflammation of the pancreas called pancreatitis. And basically, these medications are FDA approved. So we know that they meet those standards for safety, but we now have thousands and millions of people using these medications, and we're having this glucagon-like peptide, GLP-1, and potentiation of the receptor, where the cells in the bowel and muscles and elsewhere around the body hear the signal. We're having the zone flooded with medications that leverage this pathway. And that's not a functional medicine style approach, because the functional medicine style approach is what the father of functional medicine, Jeff Bland, would say is the right amount in the right place at the right time. So insulin and glucagon have this dance that they do. They're almost the one is the sun to the other one's moon, or vice versa. Glucagon pens are used for people in diabetic crises. So they're sort of opposites in a way. But glucagon-like peptide and the signaling pathways are much more complex. That little sort of cartoon of glucagon and insulin as competitors or counterbalancers falls apart a bit. Mainly, glucagon-like peptide is a signaling molecule released from the bowel in response to eating, primarily healthy vegetables, primarily bitter foods. And so we can take advantage of this signaling to decrease inflammation, keep insulin and blood sugar low and flat, reduce inflammation, help people with weight loss. So how can we do that in this elegant fashion? Well, for today's purposes, just know that the reminder is supplements are called supplements for a reason. So I'm really excited about these new supplements that are available. But at the same time, they work well when you remember that you can't lifestyle your way out of a mental, emotional, spiritual hole. You need to know who you are, be comfortable in your own skin, whatever that means for you, and then you're in good position to leverage lifestyle. In the domains of lifestyle, you need to be getting good sleep, you need to be moving, eating healthy whole food, managing your stress and connecting with people. And that has qualitative benefit, meaning any dose, as you make a play in those domains, start sending signaling cascades of healing through your body. So you don't have to live like an Olympic athlete or a monk, but need to make a play in the lifestyle domains, because you can't supplement your way out of a lifestyle deficit. But once you've done those things, then you can use this derivative of hops, because hops is one of the bitter things that triggers release of GLP and potentiates the receptor to listen to GLP-1 signaling. So there's a supplement, Calocurb, which is Amarasate, that's been demonstrated to have a high degree of effectiveness at potentiating this, and you can work up to the dosing on the bottle, which is 2 capsules twice a day if you want to. Make sure and talk to your medical provider if you have any questions or concerns. This supplement would not be a good idea for anybody with a history of pancreatitis, pancreatic cancer, small bowel obstruction, short bowel, etc., just because we know GLP-1 meds can have those complications. However, if you're intrigued by essentially just amplifying what you would be doing by eating foods in particular that are bitter, or what are called bitters historically in natural medicine, then this calo curve can be really clever. And once you've titrated up to the target dose, it's 2 capsules on an empty stomach before the 2 biggest meals of the day to release this cascade. And then what we'll see in the future is Fullscript has built a whole sort of group of supplements that all work well together. 2 key issues here are just that this GLP-1 signaling can result in some changes in muscle mass for the worse. And so you want to be really serious about your protein intake and your strength routine. And so you'll see in there, there's a supplement to help with skeletal muscle mass. There's also a good source of whey protein. And then last but not least, the gut microbiome is heavily involved in these gut aspects of this GLP-1 signaling. And so there's a good source of a high quality professional grade fiber that you can consume independently mixed in liquid or with your shake or your smoothie or what have you. So I'm excited to be taking these next steps and supporting people in their weight loss journey, also decreasing inflammation, getting insulin and blood sugar low and flat. I'm excited to be affiliated with Fullscript and providing safe supplementation for those of you that are interested. You'll see a little quartet from me, just labeled GLP-1 or seaworthy GLP-1, something like that, in Fullscript. And then I'm excited in January onward to be talking to the teams that have been helping Fullscript develop these protocols and do something broader. So if you're liking this, please keep an eye out for that. Okay, thanks everybody. Take care.